Hello, Romania, and everyone participating in this conference. This is Marjola from Albania. I am a student in University of Ismail Qemali, Vlora, and I'm a student in Master of Science in this university. And the study I want to present today on this conference has to do with the patient education as a dimension of nursing care in increasing the knowledges about the self-management of hypertension. The purpose of the study is to assess the knowledge and the health behavior of the level of the education that the nurse does regarding health behaviors that patients have for self-management of having also the hypertension. The overall objective of this study is to determine the level of the health knowledge and behaviors that hypertensive patients have for self-management of the disease based on the level of the health education they receive from the primary care nurse. The specific objectives are about to determine the level of education provided by the health center nurse to the patients interviewed in a total of 80 patients in the healthcare center, to record the health behavior for taking the medication regularly, making physical activity, stopping the consumption of tobacco, alcohol consumption also, regular measurement of voltage, and changing their own weight. The study has two hypotheses that I have proved them during the study. The effectiveness of providing health education from the nurse to the primary increases the level of knowledges for self-management for the disease. Increasing the level of knowledge through health education by the nurse affects the improvement of health behavior in adult patients with hypertension. In Albania, the number of people suffering from hypertension is very high. Group disease is called diseases of the circulatory system. The leading cause of death in men and women. Of the 14,422 deaths from the disease group, 45.8% are female and 54.2% are male. About the population, there are 464.2 deaths among women and 552.5 deaths among men per 100,000 inhabitants. Blood pressure and pulse are measured daily. The patients should always have stockpiles of medication when they are traveling or outside home. The patients should be able to control the sign of hypertension by changing their the signs of the usual behavior that they have when they don't have hypertension. The patient should eat healthily and perform physical activity as much as possible, and also by looking their possibilities of making activity, physical activity. The nurse collects information about the patient's needs and formulates a list of nursing diagnoses. The nurse develops the care plan outlining priorities and goals. The nurse determines how the plan will be implemented and specific nursing interventions, including here advices, direct advices, evaluating information on how well the goals were achieved. The nurse should recognize other family members who have direct influence over the patient. Education is a good tool to empower patients by enabling them to be active in the care and to ensure a safe ongoing transition. Recognizing the importance of the disease, family members prioritize home care, emotional support, healthy food, and direct patient care. Healthcare for a family member makes inert healthcare and education go to all the family members. The study included 80 patients, adults over 18 years old, suffering from randomly selected hypertension, a typical history of hypertension for at least 1 year duration. They also had to be residents in Vlora area, the city that I made the study. It was not a condition to this patient did not necessarily suffer from other diseases as well, as this did not impact on my results of the study. the data relating to the level of knowledge of their education by the nurse of the health center, the knowledge that the patient has about lifestyle, diet, physical activity, measuring blood pressure, and taking medication regularly. The people that were diagnosed with hypertension, less than 1 year, there were 38.8%. 1 to 5 years, 36.3%. More than 5 years, 30%. Educated by the nurse, 12.5% were not educated, and 38.8% were educated by the nurse. And they took information into the healthcare center, 48.8%. There are patients that can count calories, and on the other hand, there are other patients that cannot count, or they do not know how to count them. And this was on the percentage of 46.3%, and the other part that knows how to count the calories are 53.8%. Physical activity and the importance of making physical activity. There are patients that they walk more than 1 hour per day, 37.5%, and they walk 30 to 60 minutes per day. It's 52%, which is a good percentage. And those that walk less than 30 minutes, it's 11%. Also, smoking contributes on the health of the patients by educating them. When they get the information, after they also get diagnosis with high hypertension, 38.8%, they stop smoking, and 29% approximately, they have never smoked, and they didn't, even though they were diagnosed with hypertension and other risks known by the healthcare providers. They didn't stop smoking at the percentage of 32%. Also, a point of my study was the blood pressure measurement regularly, 2 times a day. It was about 34%. Only 1 time a day, it was 31%. And at least once a week, it was 25%. And they never did the measurement of the blood pressure, was 10% of the patients that I took to my study. The study shows that 38.8% of the patients suffer from hypertension generally receive health education from the primary care nurse. Patients with hypertension who have more knowledge about the management of their disease are residents of Vlora. Hypothesizing that the effectiveness of providing health education by the primary care nurse increases the level of knowledge about self-management of the disease and obtains that we get the information about that. Patients who have been informed by the health center nurses have knowledges on daily calories and healthy eatings, and the T-square statistical analysis showed us that there is a statistically significant relationship between the variables, which means that the effectiveness of the knowledge that the patients receive from the nurse increases the level of knowledge for an approximate calculation of daily calories by building a correct diet. Here contributes even educating with the dealing with the family. Patients with more than 5 years who have been diagnosed with hypertension, regularity in taking medication is at least 55 years old. Physical activity, 51.2% of patients selected on this study walk 30 to 60 minutes per day. The majority of patients, 38.8%, say that they through they have been smokers, they quit after learning about their disease, the importance of it, and the effect that the smoking has on this disease. In relation to that group who continue to be still smokers, they see that most of them are men, obviously. Also, 41.3% of the sample claims that after being diagnosed with hypertension, they have quit alcohol. According to statistical data, the frequency of measuring blood pressure has come as a result of health education of patients. Another improvement that health education has achieved in the behavior of patients is that the change in the body weight, which has led a proportion respectively 35% of patients to weight loss, because they can also count their energy that they take from the food. In conclusion of this study provides modest evidence of the level of health education that nursing provides to hypertensive patients in primary care. The hypothesis was confirmed that the effectiveness of education by the nurse increases knowledge and improves health behavior in hypertensives. The level of health education delivery by nurses in health centers remain relatively low. Patients who receive education have significantly improved health behaviors compared to those who do not receive an education. Patients receiving education and physical activity are also low. The recommendation about this study that I have found during making it, the necessity of educating patients with hypertension in order to avoid other complications. It is essential to undertake prevention programs with a special focus on the management of hypertension's risk factors such as lifestyle-related factors, excessive alcohol consumption, smoking, physical inactivity or sedentary lifestyle, excessive fat consumption, and control of salt consumption. Promoting healthy behavior is a preventive step in the development of hypertension. Specific training of family nurses is needed in relation to health education for chronic diseases such as hypertension, diabetes, etc. There is a need for at least one nurse in each health center to provide group health education for all the patients with the disease. Thank you very much, and I wish everyone good luck in the working process of the conference. Bye-bye.